Welcome back to the Bluelight series on light curing excellence. In Module 3, we're going to be putting it all together. In the first two modules, we talked about why light curing is not always as easy as it looks. Ensuring that a curing light delivers the right amount of energy to a light-cured material is challenging for several reasons. First, lights aren't always working as expected. Even if a light looks like it's working because it's giving off blue light, you don't really know unless you measure its output. The light's output may not be what the manufacturer says it should be because curing lights degrade over time. Debris on the tip can also reduce the light output, and using an infection control barrier, which is good to use, can reduce the light's output by up to 30% if the barrier isn't transparent or isn't fitted correctly. Second, there are over 800 lights and over 1,000 light-cured restorative materials, which means there are 800,000 possible light material combinations. Each light model has unique characteristics, and that impacts the energy it delivers. Likewise, each material has different energy requirements for proper curing. Even if you only use 3 to 5 lights and 10 different materials at your clinic, that's a lot of combinations to consider, especially if those lights are different models. Even if the lights are the same model, their outputs can differ because of age, damage, or things like debris on the tip. Finally, light operators may not have received much training on light curing. As a result, they may not be aware of things they need to watch out for. This matters because patient care suffers when an incorrect amount of light energy is delivered, as we learned in earlier modules. For example, pain or sensitivity results from undercuring, if an uncured composite is left in a deep restoration, or partially debonded material causes micro leakage and recurrent decay. Sometimes pain results because too much energy is delivered to the patient's soft tissue. That is, the soft tissue is overheated. This can happen when the restoration is near the gingiva, as shown in the bottom middle photo. Lastly, premature failing of fillings in the form of debonding, composite fracture, and discoloration is another effect of undercuring. If these failures happen in the first 2 years, they can result in costly redos. The good news is that Bluelight equips you to manage all these risks with some simple tools for consistent light curing and great patient care. The Bluelight hardware and app allow you to test your lights easily. Setting up the app by entering your lights and materials takes less than 15 minutes. Once you've done that, testing each light takes less than a minute, which means you can test all your lights in the clinic in 5 minutes or less. The app contains a curing advisor that color codes your test results. When you do a light test, you'll get an instant green, yellow, or red indicator of whether everything is okay, you should utilize caution, or do not use this light. The curing advisor gives you curing times for each light material combination and warns you when there's an incompatibility. You also have access to online education on light curing through these training videos, which you can access anytime. Finally, Bluelight's dashboard lets you track your light curing readiness and download all of your light test results. So what items should you have at your clinic ready for light curing? Of course, we're going to have eye protection. Then there's the curing light. You're going to want to have it tested so it's working and ready to go prior to the dentist starting the procedure. For your light cured materials, you may have bonding adhesives, liners, packables, flowables, resin composites, sealants, cements, posts, and cores. So you want to check that your expiration dates on your materials are within normal limits and know your proper light curing times. Also, we know in today's world, your tray may not look exactly like this, it may be covered, but this is an example of what you might have for your light-related items on the restorative tray. Here are some tips for light curing to ensure great patient care. Step 1. Test your light output weekly using the Bluelight hardware and app, and I would suggest that you pick the same day of the week and have accountability for this task. Step 2. Before curing, inspect the light tip, remove all debris, and apply an infection control barrier. Step 3. Check your light is set to the correct mode and time using test results in the Bluelight app to get curing times that comply with the manufacturer's instructions. Step 4. Verify access to the restoration and determine if the situation needs heat management using the heat warning icon in the app's test result page. Step 5. Cover the restoration with the tip. If the material is greater than 5 millimeters away, what are you going to do? You may need to increase the exposure time. Step 6. Wear protection. Stabilize the tip and watch the position of the curing light. Step 7. Keep the tip close to the restoration for the duration of the recommended curing time. Getting started is that easy, and there's so much support at Bluelight. Online videos are available to walk you through each step, and they're about 1 to 2 minutes each. They include videos on how to add your materials, how to add your curing lights, how to complete your first light test, your curing advisor and what it's all about, and how to interpret your test results. If you run into any problems or have any questions, please feel free to email checkup_success@bluelightanalytics.com or give our customer success team a call at 902-407-4242. And it's that easy to get started. Thank you for completing and participating in Module 3, which is the last in our series on light curing excellence. Congratulations and happy testing.